I'm ready.
Okay. Okay, let's see what we have here. All right, well, let's start down in the pelvic cavity. We do need to do a little bit more dissection to see the bladder and stuff, but we'll go with what we have so far. So, this is the diaphragm here, and you can use the diaphragm as a landmark to help you identify what's above the diaphragm is the thoracic cavity, and what's below the diaphragm is the abdominal pelvic cavity. And certain organs are only going to be in the thoracic cavity or the abdominal pelvic cavity. So if you can find the diaphragm, then it helps you kind of eliminate what organs it couldn't be. So this is the liver. So there's actually several lobes of the liver. So notice that these all look kind of the same. And then if I gently lift the liver up, this pouch-like organ right here is the stomach. And it can be a little difficult to see the J shape to the stomach, so because the rats are so small that you might need to actually kind of move things around. But you can see how big the stomach is. It goes all the way back there. And so the J goes this way, and the end of the stomach is approximately right here.
Yeah, you're recording.
Where you can see the pinch. That pinch right there represents the pyloric sphincter, or the end of the stomach. And then here, what we're looking at mostly kind of looks like a big mess, but I'm going to pull this over to the side so we can look at the left side of the rat. Thank you. And this organ here is the spleen. A lot of people confuse it with the liver because they're really similar in color, but if you notice, the spleen is below the stomach and appears to be coming from the back, and it's actually detached from the liver, so they're not the same organ. And then these are all intestines, so this is mostly small intestine, but then I don't know if you can tell the difference. See, this obviously looks really big. So this is a portion of the large intestine. Now this is first part. It looks like a big pouch or a sac. It's called the cecum. And so it's pretty identifiable compared to the other intestines. And if I move the cecum around, you can tell that's still small intestine if you look at the diameter. It's very narrow. So the small intestine empties undigested food first into the cecum, and then that undigested food is going to pass through the rest of the large intestine as it gets processed into feces. So sometimes it can be hard to tell where to go next. So I'm actually going to go and move the intestines over, and I'd like you to see this is the large intestine here. Now it's a little bit smaller in diameter than the cecum, but it's still part of the large intestine. And if we look, the large intestine, appears to be going straight down. So it's going to lead to the anus, which is underneath the scrotum here. So feces is going to be eliminated that way. So by identifying the rectum here and the large intestine, then we can actually kind of trace the large intestine around right there, and it gets a little small, but that's still part of the large intestine. And then gradually you can see that we lead to the cecum. So all of that's large intestine there. Now the pancreas can be a little difficult to identify, so I'm going to lift up the liver, and I'm also going to try to lift up the stomach. Now in some rats it's pretty obvious, but I don't know if you can tell. This is part of the small intestine, so I'm going to try to pull the large intestine over, and the pancreas is this delicate kind of mushy material right here. So let's see if we can see it better from the back. So I don't know if you remember, I told you it was going to look a little bit like cottage cheese. So you can actually see a lot more of the pancreas right in that area.
Right there.
And also, to me, it kind of looks like beef or steak. You know, it has that sort of marbling pattern. So that's all pancreas right there. All right. And then the kidneys are right there, and they're behind the peritoneal space, so they're embedded in tissue. So a little bit later, you guys can actually just sort of excavate the kidneys out like that, so they're a little bit more obvious. And we'll try to find the ureters, which are also embedded in this tissue, but we have to excavate them out in order to see them. And so this is the right kidney, and then the left kidney will be on the opposite side. And since you do have a male, we'll try to identify the urinary bladder. The urinary bladder is this tiny little pouch right here that almost looks like nothing.
Like a bean.
Yeah, it looks like a little bean. And what we're looking for are some of the organs of the male reproductive system. So there's a big pair of glands right here, this one and this one. And notice that they're lateral to the bladder.
Yeah.
So these are the seminal vesicles. And then the prostate gland is supposed to be below the bladder. So I believe, see, it's a little bit different in color, and it looks like an even smaller bean. That's the prostate on one side, and there should be, yeah, I can see them better today. There's the other prostate gland right there. And then here, moving into the scrotum, do you see this long tube? That's the vas deferens. So it's going to transport the sperm from the testes up into the urethra so that the male can transfer sperm to the female. So this is the testes here.
Only one?
No, I believe there should be a second one on this side.
Okay.
And then the epididymis is a little hard to see. It's a coiled... Oh, no, there it is. It's just covered with some fat. So I don't know if you can tell there's a slight texture. That's the epididymis, and then this is all fatty tissue that is just kind of on top of the epididymis there. So those are most of the organs so far, and the penis, oh, I see. The penis is right here. And so remember we talked about them having the sheathed penis, so it's actually not really visible. We just see the area where the penis is located right there. And then, we didn't go over the thoracic cavity yet, did we? Okay. So then if we go back anteriorly or towards the head, we look back for the diaphragm. So these are ribs that are covering the heart and the lungs. So what we need to do is actually still cut away some of this tissue here. And so the easiest way to do that is just to kind of insert your scissors and cut. And that sound is they're cutting through bone. So just do a little shallow cut and try to pry away. And so we're cracking some of the ribs right now. Alright. Okay. And what I'd like to see is the trachea too. So there's muscle tissue. So underneath this is the trachea. So I'm going to just set that aside. Pull that aside. And can you see that there's an obvious tube right there? Alright. So that's the trachea. And I'll let you guys excavate around, but just behind the trachea, if you kind of make, it should be the esophagus, which is a flat tube. So again, rather than doing any cutting, just try to maybe move and separate. And then I think this is the esophagus here. Yeah, you can start to see, I just poked a hole in the trachea. But you can start to see that when I pull the trachea, there's another structure that's moving with it. That's the esophagus there. And this brownish mass right there is part of the thymus gland. And it sits just above the heart. And so that's the heart there. And then here's 1, 2, and 3 lobes of the right lung. And then to see the left lung, I need to pull the heart a little forward. And then there's one of the lobes of the left lung there. So, I mean, that's most of them. So we still need to try to find the ureters, but we would need to remove some of the fatty tissue. But for the meantime, that's most of them.
All right.
Thank you. All right,
Thanks.
sure. That I want my money. I'm just kidding.
No.
Yeah. Okay. What are your questions? And we either send us an answer simultaneously or just finding something.
We just really quick on